My name is Lydia Rajpat. I'm the family support worker here for Toronto Western Outpatient Mental Health and Addictions Clinic. And this program provides service for UHN patient families as well as outside in the community. We've been happy to connect with just some wonderful family members referred to us by the Depression Center, as well as various other clinics within UHN and also outside in the community. So I'm just going to quickly overview what I'm going to be talking about. For the sake of time, I'm just, mindful that we've gone over a bit. I might not discuss all things, but we're going to define the program for family support here at the Western. We're going to talk about the three main branches of care, and I'm really going to kind of introduce or review a wonderful tool called the Mental Health Continuum that many caregivers just utilize as they're kind of supporting somebody and also just something for themselves. We're going to kind of review how this program can assist the caregiver journey. And really, one of the main things that can come up as a caregiver is burnout. And then discussing how to have the protective factors for burnout, which is defining and understanding resilience, and then looking at some resources for self-care. Now, family support. So what is family support here at the Western? So the program, I hope everyone can see it because the sidebar here is, okay. So the family support program helps family members who are directly supporting somebody with a mental health or an addiction issue. We provide one-on-one support as well as group support or family group support. It is an intentionally easy access, low barrier program. So if you don't have to be registered or provide any of OHIP registration, you can self-refer, have your GP refer you or a clinician who knows about the program. There are three main branches of care, such as psychoeducation, service navigation, and supportive counseling. There's one limitations within this program is that we don't offer psychotherapy, as we identify family support to be very specific in need and will require a different approach. As I'm going along, I do want to really engage people to ask questions about the program or if I was unclear about anything. So there's a Q&A part, and then if you feel like you want to make a comment, you can also utilize the chat. So the first branch is the branch of psychoeducation, and that's the two main things that come up as I'm providing care for caregivers is helping them identify symptoms and learning the language. And this is really, really essential for caregivers because they're walking into sometimes a situation that's so new and overwhelming, and they just don't know how to identify and what to do to respond. So depending on the unique need of the caregiver, sometimes language and increasing understanding about the illness, symptoms, and behavior is really necessary. And a major portion of the work, which will spill over, is just improving communication. So communication will start to shift from speaking at your caregiver to at your loved one rather, or friend, or whoever you're supporting, in a more affirming way. And that is sometimes going to be encouraging, using motivation tactics, as well as on the flip side, you're going to be identifying boundaries in the relationship of the person that you're supporting if you are a caregiver. And then sometimes you'll find yourself using things like empowered speech. So, and you'll notice that you might be empowering yourself. So the education piece is really important as a caregiver because you become empowered, but you're also going to empower the person that you're supporting as well and offer that redirection as you're getting support. So one really, really helpful tool that we have found is using something called the mental health continuum model. And this was designed by the Canadian Armed Forces. I hope I'm correct in that, but I did some research and it said it was, something to attribute it to our Canadian forces. And this is really effective to demystifying and destigmatizing mental health in general, especially when you might be walking into something for the first time as a caregiver, witnessing a friend or a loved one experience something that's quite intense and new and really overwhelming. And a lot of the times, caregivers will ask me, I just don't know um, what to do and what do I look for and how do I react if there's things going on and I just don't understand. And I will not go through all of the points in each section, but I will talk about the protective factors that are listed underneath. And as I said, this is a really great tool to help demystify and destigmatize mental illness and also bring into the understanding that sometimes mental health can fluctuate. You can be having a period of time where you're doing well, and then circumstances happen, and sometimes for no reason or because the illness is present and it's changing, there will be different stages of symptoms that are occurring. And so as a caregiver, you want to kind of look at the person as a whole in a holistic way. You're looking at both the biology, and so you might, yes, require things that need medication, and as well as psychologically, they may need to start seeing a therapist, or socially, they just need to start connecting with their community if they're isolating. So I will go over the first part, which is healthy, and it's pretty straightforward. We're going to see signs of having someone having a normal mood. They're pretty balanced in their life. They've got a routine. They're consistent, and they're just socially active as well as physically active. And they sometimes can appear to have confidence. And with confidence, you'll see things like they've got a sense of humor. As a caregiver, this is a really great thing to witness your loved one doing really well. And one of the protective factors is to nurture supports that are kind of maintaining this level of a wellness and health within a whether it's a loved one or spouse or the person you're supporting. The second one is reacting. And this is where you start to kind of see signs of just irritability occurring. Where you had consistency before, you're having some inconsistencies now within tasks. There might be some forgetfulness. You'll see such a drop in energy, increase in muscle tension. So they're just kind of tight in their body. They're holding their shoulders up kind of high. You're just seeing some of these physical signs that, okay, there's something producing increase of these symptoms. And you might notice some sleep disruptions and the increase sometimes of substances. So before, perhaps they may have had only one drink of alcohol or wine or something at dinner. Maybe they're going for a second one. And then this is where you start to kind of notice social reclusion. And that's where they may not want to engage, like going out for walks before if they were doing that. You kind of notice some of these things occurring. And a protective factor against this, if you are witnessing something occurring within yourself and also somebody you're supporting, is recognizing capacity. So capacity really matters, and recognizing limitations. So one of the things is that would be really helpful is taking intentional breaks and being very mindful of the fact that, okay, I was doing well before, now I've got these new symptoms occurring. I should probably take a moment to be intentional with my breaks and engage in supports early. The third one is injured. And this is where you do see more prevailing symptoms of anxiety. You might notice, or you might be experiencing some outbursts of anger. Sadness is more pervasive, and there's feelings of hopelessness occurring, and you might just be questioning your worth. There's some poor concentration happening, which is impacting performance at work or school. And this is where you're noticing, okay, you're having more disrupted sleep. So perhaps you're just experiencing symptoms of insomnia a couple of nights a week, or you're having difficulty falling asleep or staying asleep. And this is also now going to impact your social circle. You're just not wanting to engage with people that might be close to you. You might be living with someone and you're just not really engaging with them. You're kind of isolating and going into your room or a bedroom. And then we also notice the increase of substances exponentially as well. And one of the protective factors here is trying to challenge the avoidance and also seeking help um, because you've challenged and you're going to increase some insight about your what's happening to you. So you're wanting to observe, you're introspecting a little bit more about the distress that's occurring in your life and the pathology of symptoms that are occurring. So if you are a caregiver and you're witnessing something like this happen to someone that you're supporting, challenge the desire to isolate. So I believe it was Hannah, she was talking about how if you don't want to go for a walk, it's really kind of a challenge and you fight yourself and you resist. This is going to be great if you're a caregiver to really gently motivate and challenge your loved one to, yeah, let's try and go for a walk, especially if it's a beautiful day, or reintroduce things that were really helpful or things that they may have enjoyed that they're no longer engaging with, like painting or a type of music or genre of music that they may have participated in before. So introducing things that they really enjoyed before. And a lot of the times they will start to see some ineffective, like caregivers will start to see some ineffective coping mechanisms, and reintroducing things that used to bring joy would be a wonderful protective factor for the person you're supporting in this stage. Okay, and so the last stage is the red zone. And this is where a lot of the times I'm getting referrals. Family members are utilizing the family support program because they're witnessing just these really, really intense symptoms. And that's where you have the intense anxiety. Sometimes your loved one might be experiencing a panic attack. There's suicidal ideation and intent. You do see a marked depressed mood. The insomnia is very prevailing. And then you might even witness them just fighting a cold constantly, or just feeling or battling some sort of illness. And then really there's a struggle to concentrate. So tasks that they could have done before, they're just not able to even approach. And then sometimes you'll have, just on the extreme spectrum, some unusual sensory experiences. And this can kind of speak to early signs of psychosis sometimes. And then you'll also just have the substance use occurring just more regularly, maybe on a daily basis. They're consuming something. And this is, again, a way to cope. And that's where they really need to introduce some better coping mechanisms, which would require support. So with that being said, this is a really helpful tool for family members to kind of identify, okay, what could be happening or with somebody that I know might be struggling, but I just don't know what to do and when to intervene. And on the jump side of this, I do encourage people to utilize the mental health continuum and then find a route or a mode of intervention for the next step. And this goes to the second branch within our program, which is service navigation. And so depending on where your loved one is on the spectrum or on the mental health continuum, you may have to utilize modes of intervention. And the first one, which I kind of call the more, if there's a crisis occurring, is utilizing the healthcare system right away. And that's going to the hospital ER, speaking to their GP, or other forms of kind of strong interventions. And then also community. And this is sometimes if they're in the yellow zone and they just kind of need to talk to somebody, or if they need to address a specific kind of need, such as housing, I would say local supports. And I will be including a bunch of supports that are central to downtown Toronto, accessing 211, or if they just need a rapid access clinic because they are experiencing a substance use issue. The third mode of intervention, which is ongoing if you are going to be getting support, and I always kind of say is the most kind of unique and phenomenal one, as a caregiver is the use of the interpersonal relationship and boundaries. Um, Depending on the relationship you have with the person you're supporting, you may be able to have far greater influence to intervene and invite collaboration than myself or any other practitioner that your loved one might come across. And using family dynamics and motivation through information that you might get through the program, you could definitely provide easier access to services or invite your loved one to treatment through the use of your relationship and through those things that I mentioned, like affirmation and encouragement and empowerment. And then sometimes service navigation is required as you're planning for safety and advocating if you as a caregiver need to have a safety plan and an emergency plan, if they're resistant to treatment right now, or if they're resistant to talking to anybody, having a good like Rolodex of services available that are local is really also very helpful and can help alleviate some of the anxiety that can come up as a caregiver. And then the third branch is the supportive counseling piece. And this is where, as a caregiver, the bulk of the work is also done as well with us in the family support program. The caregiver journey is a very unique one. It's not linear at all. And caregivers are wearing multiple hats. They're not just somebody to provide support through helpful conversations, but they're sometimes monitoring medication. They're talking with the doctors on behalf of their loved ones or friends. They're navigating the service of mental health. They're fluctuating between many different roles, and it can become very, very intense. And as a caregiver, sometimes you're paralleling the role of the person you're supporting. For instance, if you're an adult and you're watching a parent kind of go through mental health, whatever that mental health or mental illness is, you yourself are going to witness those symptoms and walk the journey with them, and your capacity is going to definitely be impacted. And sometimes, as the person you're supporting is going through treatment and intervention and recovery, you yourself are going to simultaneously and vicariously kind of go through recovery as well, which is going to mean that whatever negative feelings or emotions came up in the process of caregiving have to be addressed. Or if you witness something that was really startling and shocking, it can produce some of the vicarious trauma that can come about. And so the caregiver role and journey is sometimes paralleling that of the person you're supporting. And so it's not going to only be as separate as we think. And you do need to be mindful of how it can impact you and addressing those needs that you might minimize at first, because you might say, well, I'm not the one who might be struggling with this, but you are also experiencing a lot at the same time. Okay. And as a result of sometimes the capacity that's hit, you're going to experience caregiver burnout. And I really want to help kind of advocate and normalize the caregiver experience. And burnout is something that you can experience whether you're a caregiver or if you are a parent and you've got newborn children. You're constantly giving out, you're constantly pouring into another person. And because of a variety of factors, such as prioritizing the needs of another person or minimizing yours because you may not be struggling with that issue, it can be detrimental to your own wellness and really disempower you at the same time. So I do want to kind of ask, if we can, if the participants want to throw out what they think caregiver burnout really is. We've heard of it before, but I kind of just want to engage the audience a little bit. Okay, I'm seeing some of the questions, but I wonder if Jenna, you can see anything in the chat.
I do. I see comments on complete exhaustion.
Feeling resentment, I see that too. Very, very, very honest and applicable. Yeah. I'll give it
Feeling numb.
Feeling numb. Okay. Thank you. Thank you, everyone, for participating.
Ambivalence, anger, resentment, inability to feel compassionate. Maybe if someone is elderly, caring for a family member, disconnect, loss of interest, lack of energy.
Wow. Okay. Very, very honest and very, very applicable. The definition is not going to touch on all of those, but I'm really glad that I did this because in the definition, I can bring us back, it's defined as a state of physical, emotional, and mental exhaustion from the stress of caregiving for a loved one. And all of those things that were provided by those watching can be included. It's sometimes really difficult to validate your feelings when you are caregiving for somebody who might be prioritized by maybe a different hierarchy of needs and systems. So thank you for being honest. One of the main causes for caregiver burnout is role confusion. And this occurs sometimes at the start of when an illness is the onset of an illness or whatever mental health or addiction challenges that might be occurring. And so in the middle of just everything just kind of occurring, it's all very new. We will see people who may not step into a role of leadership, nurturing, some type of almost like parenting and caregiving where they never were before. And you'll see kind of people overstepping boundaries that were there before, and there'll be a confusion of roles. Do I do this or does the person do this? So it's almost like some autonomy can sometimes be confused. And what used to be somebody who was functioning, they just can't do it anymore. So you as a caregiver will step in, which can confuse a role. Sometimes there's too many responsibilities. For instance, if somebody had to take time off work, and you had to help them fill out some of the paperwork for insurance purposes, you'll find yourself managing that. You'll find yourself maybe managing booking appointments. Sometimes it's going to really practical things like daily living tasks, helping them maybe prepare a meal. You might be doing all of these things, and you are also trying to live your own life and manage your own self-care. So quite a lot of responsibilities. And then this can lead to the unclear and unreasonable expectations that can come up just because of the role confusion. And then also a major portion of burnout is just the lack of resources and trying to control everything when it looks like the situation is out of control. And so it's really just, it's almost like a runaway train when you are encountering caregiver burnout. I'm going to just pause for some reflective questions, and I really am hoping that people can, if they want to, they can unmute themselves and speak, or you can, again, utilize the chat. But it's kind of just to kind of gauge where you're at if you are experiencing burnout. The first question is, and you don't have to participate if it's too personal, do you often feel your relationships are consistently focused on the well-being of others? And we'll just take a moment for people to respond. I'll go to the next one. Do you often struggle to separate yourself from the person you're supporting physically, mentally, and emotionally? And lastly, does the idea of a boundary produce greater stress than the idea of its reward, such as greater autonomy or freedom to pursue other tasks? I'm not too sure if people are wanting to speak, so Jenna, I'll let you kind of engage the chat or view the gallery a little.
I see some reactions coming up, some thumbs up to some of those questions, especially the do you often struggle to separate yourself from the person physically, mentally, and emotionally?
Okay, great. If you did answer like a majority of yes to the three, then I would say, okay, these are some red flags that you might be experiencing burnout already or on your way to burnout. And I'll just kind of go through some of these signs of what burnout can look like. Some of the participants, you were really great to identify what it can feel like sometimes. Jenna, stop me if you need to jump in and address something. So, with the signs of burnout, you can have some pretty intense feelings and emotions, and you can feel overwhelmed and trapped. I know I heard resentment. Caregiving could be controlling your life. You might be feeling impatient or irritable, or you might argue with the person that you're supporting with, even though that's kind of counterintuitive to what you want to do, which is help them. You can have anxiety about the future, about their wellness, about your wellness, finances, and things like that. You can also experience depression and mood swings. And I'm really, really grateful that Hannah and Lauren, they addressed what depression can look like and also how that can impact your nervous system as well. Really, really helpful if you are experiencing this right now as a caregiver. You can also experience some hopelessness, despair, feelings of sadness, anger, rage, shame, guilt. Those are very common as a caregiver. Physically, you can start to have just low energy, overwhelming fatigue. And this can mean like, say you had a good night's sleep, 8 hours, but you're still waking up very tired. And then sleep problems. Like I said, you're getting too much sleep, but you're feeling that fatigue or you're not getting enough sleep, which compounds on the fatigue. So it's a vicious cycle. You can have just eating habits that are kind of wonky and you've got weight loss and weight gain. You yourself finding yourself kind of withdrawing and losing interest in social activities. And then you start to kind of neglect your own physical and emotional needs. So perhaps you're maybe not caring about what you're wearing that day or how you used to have a particular style. Um, you're neglecting, say, for instance, you've got your nails done every week and now you don't. Does someone want to jump in? I'm hearing a mic on. Oh, okay. Another one of the physical signs, which I thought were really, really interesting to kind of note, were yes, dealing with difficulty with everyday things, and this can be like you just can't cook yourself a meal anymore. This is really becoming an issue. You just like getting those items in place, pulling them out of your refrigerator. This is something that you could have done easily, but you just can't do anymore. You might be experiencing more headaches, stomach aches, physical problems that just weren't there. You might be getting sick more with a cold or whatever the issue could be. And then also, I really kind of noticed that you can have an increase in back and neck issues. And I don't know, this could be because of the physical toll of sometimes having to deal with the nature of the illness that's with the person you're supporting, but also stress that's compounded and chronic. Research has shown that sometimes just the tightness in the body can impact shoulders and neck. And then we see things, complaints within caregivers, just having that stress on the body present in the back and the neck. And these are issues that were never there before until they maybe started the intensity of caregiving or caregiving that's now chronic. And then behaviorally, as I mentioned, you're just not as social. You might be seeing something called self-sabotage. And this is where, for some reason, you are just not prioritizing yourself. Or if you have a particular task, let's say you're at work or at school, you will save it for the last minute because you may have been caregiving or you feel like it's inner conflict within yourself of guilt that I should only be taking care of this person or it's basically the caregiving balance is outweighing itself, and you might be sabotaging things that used to be important to yourself. Hypervigilance, poor coping, and poor self-care. I want to kind of touch on hypervigilance because in the first presentation, they talked about self-soothing and reacting to the idea of threats and the stress that's produced. Hypervigilance with caregivers can also come about because of, again, depending on the nature that you are of the illness that's within a loved one, or whatever is happening, whether it's addiction, there may have been really strong reactions and fears at the time of perhaps maybe when you came on board and started to caregive. And it can produce a lot of fear, and it can produce hypervigilance, which is if you see your loved one kind of act in a particular way, even though they may not be going into that red zone of symptoms, you might be thinking they are in that red zone, which would require uh, intervention and can produce a reaction of intense fear and anxiety. And your fight or flight response could be on all the time. And I see this often with caregivers is that they're always thinking that they have to be on, and they produce this hypervigilance, which is kind of perpetuating some of the symptoms like withdrawing, kind of living in fight or flight. So they sabotage some of the things. They just can't engage with their self-care anymore, and they might be kind of coping with poor mechanisms like binge watching TV or eating poorly, or they myself might start to use a substance. And so, in light of burnout, we want to look at some of those protective factors that can help combat burnout, address burnout, and build capacity again. And so, what is resilience? I'm looking at time. So, I will ask the chat what they think resilience is, and if they want to speak or if they want to use the chat. If not, I can go on.
I see a comment being able to bounce back from challenges.
Excellent. Yeah. So that's really, really true and applicable. And it speaks to, I'm going to address the definition after, but I will start with what resilience is not. Oftentimes, there's a couple of myths that come up with resilience. And one of them is to be a resilient person, you have to do everything on your own. Asking for help is a sign of maybe not being resilient. Another myth is that it's something that you have or you don't have, something that you were born with innately. Resilience can be fostered and have growth and improved. It's something that can definitely be built upon. And resilience is another myth is appearing to never have a stressful day or difficulties. Plenty of caregivers will struggle with managing the multiple hats that they're wearing. And there will be some kind of shame and criticism, an inner critical voice that will say, well, I'm actually not doing a great job, or I'm not as resilient as I would like to be because I'm having a bad day. Resilience is not about looking like you are immune to the very real and taxing role that you're playing to carry another person as well as carry yourself. And the definition from the American Psychological Association is resilience is both the process and the outcome of successfully adapting to difficult or challenging experiences. It's having the mental, emotional, and behavioral flexibility and ability to adjust to both internal and external demands. And I will kind of talk about flexibility and adaptability. When you are going through these two very real, I guess, transition points, sometimes they look messy. Sometimes they're not always going to be as smooth as you would like, but that in itself is producing resilience, and it is you being resilient. And it is also acknowledging that if you're adapting and constantly in a state of flexibility and having to change, it's quite impressive. And there should be some sort of acknowledgement and compassion towards the self for the fact that you are doing this and congratulating yourself at the same time. So we want to build resilience. And so this is going to talk about honoring yourself. A lot of the times as caregivers, you are focusing on another person. And so it speaks to the self-sabotage. You want to start to honor yourself. So if you made an appointment to go get a massage and you feel a little guilty for doing that, honor that by going. Definitely honor the things that you used to do before and making time for that, because you are going to allow yourself to feel heard, feel seen as a caregiver. And that first starts with yourself. You want to have that education piece. You want to utilize all of your supports. Oftentimes I will hear caregivers say, well, yeah, I have my person. I have one person that just listens to me and they help me. But sometimes to prevent burnout, you kind of need to explore other supports as well. And this can be utilizing a family support program like ourselves or connecting with other caregivers. And so that might be a group, or maybe you need more support, such as perhaps maybe seeing a therapist or seeing a counselor or seeing somebody that can speak to your own unique needs. And this is also helpful if you have a community, such as a faith-based community or a cultural community. So using that for support as well. Another thing for building resilience is getting comfortable with defining boundaries. And that is kind of reintroducing, yes, you are a caregiver, but it doesn't mean you're going to look like this or be enmeshed with the person you're supporting. You're going to start to kind of define and redefine yourself and identify yourself in the situation as well. Radical acceptance. This is something that we use in dialectic behavioral therapy, which is accepting that perhaps, yes, my loved one does have this particular illness, or yes, I have dedicated time and sacrificed a lot for this person to become well, and I want them to do well. And there might be that feeling of resentment, as someone kind of shared. Acknowledge that, and allow it to be accepted, but always offer some redirection, which is I still have options for me to explore my life and to engage in that type of thinking. So it is kind of, yes, you're acknowledging and you're accepting something that might be difficult. You're not kind of enabling it, but you are allowing it to be seen and heard, and then moving on to exploring other options so that you can feel a sense of empowerment and reduce stress. And then also, obviously, rebuilding your capacity. So this is something both to speak to taking note of your capacity. So you have to kind of do some introspection. What are you struggling with? Are you struggling to get out of bed if you're caregiving? Are you struggling to organize? How do you rebuild capacity? So this is going to maybe mean the tool that Lauren kind of mentioned, it's not Lauren, Hannah was mentioning, the base diary is something that would be wonderful to help you build your capacity as well. Okay. So self-care for caregivers. Self-care for caregivers is not just, being intentional to take breaks, absolutely recommended, but it's addressing some of the guilt and shame that can come about if you're caregiving. These are common themes that caregivers can experience because of the way that they might be perceiving the illness, of the burden of trying to balance your needs and the needs of another's, and it does depend on the presenting issue. Caregiving out of guilt is never really effective caregiving. You want to address both, yes, the real circumstance, but you also want to caregive in a healthier form, and that is sometimes going to mean you address the relationship dynamics, you address your own autonomy, and you start to explore things about differentiating yourself between you and the person that is requiring support. And this does mean that you have to look at defining boundaries. What are the things that they can do and that they might want to start trying to do? And you may have to support them. And then looking at what are the things that I'm not doing for myself, but I know I need to do because I'm experiencing burnout. So this is very real for self-care. It's very difficult and challenging, and a lot of caregivers struggle with this part because they don't know when to say maybe no or when to introduce the boundary, and it might produce a host of strong emotions. And wise mind is something that I will utilize a lot with caregivers, and that's balancing the emotions between the fear and the guilt, and then introducing some objective truth. So we're looking at, let's just give an example. We're looking at the caregiver who might be supporting their adult parent. That parent may be able to do some things on their own, but you might feel a sense of guilt to say, okay, I need you to try to prepare your meal in the morning. I'm not going to do it anymore, which might produce anxiety, which might be, you activate the shame and the guilt. However, the wise mind will say, let's find a healthy balance between acknowledging those feelings, but looking at objective truths. If your parent was able to maybe meet you halfway, they can provide some support for this task, and it can alleviate some of that shame and guilt. And I want to end with this. Caregivers are the first responders to often very, very intense and sometimes dire situations where crisis intervention is necessary, especially for mental health. And they sometimes are not seen. And I really want to acknowledge caregivers because they are kind of doing work that we don't really touch on until they come to us in the hospital or they get referred by a GP. You're constantly in a state of maybe pouring out and giving to another person. And it's really pivotal to invest in your well-being and to seek your own supports as a caregiver, considering how much might be going on behind the scenes before we ever get into the picture. And I do want to provide some resources that are within the community. Of course, our family support program, which is very easy to access. And it is, again, you can go onto the UHN website and just find family support and our referral forms there. And then also there's some really excellent community resources. CAMH has a they have a wonderful psychoeducation program for families. At the Institute for Advancement in Mental Health, they have free and sometimes paid services for family members. FAME, which is reconnects family and caregiver support, they offer one-on-one and groups as well. And Wood Green provides, I believe, a peer support as well as a caregiver group for other caregivers to connect. So these are just some wonderful supports that are available to help you build back resilience and to prevent burnout.